Thank you. And he wanted to make sure that I indicate that also we still need to wash our hands and cover our mouths. We can't lose with that. At this time, I'd like to bring up Jeff Aluotto, our county administrator, who will talk about the American Rescue proposal.
Thank you, Commissioner, and thank you, Health Commissioner Kesterman. It's my pleasure today to talk a little bit about the American Rescue Plan dollars that Hamilton County will be receiving. I think the last time I was at one of these briefings was sometime early last year as we were heading into the unknown of this pandemic. So I'm really happy to be back at a time when we, as a community, are doing the things that we need to do to emerge stronger from that. So it's my pleasure today to talk about one of the tools that we are being provided in order to emerge stronger, which is money from the federal government's American Rescue Plan. So the federal government passed the American Rescue Plan, I believe, in March of this year, which was a large bill that included in that bill was $350 billion for state and local governments to address the health and economic issues associated with the pandemic. Hamilton County was designated as a direct recipient of those funds, just like we were with the CARES Act last year, and we were designated to receive $158 million in American Rescue Plan funding. You will hear the American Rescue Plan used a lot as a term to describe numerous programs. The specific program that we are receiving the funding from is a state and local government fiscal recovery fund, but American Rescue Plan is just a lot easier, so we'll continue to use that for simplicity. The Board of County Commissioners, which has been, as Vice President Reese just alluded to, has been very aggressive since the beginning in responding to issues related to COVID-19 in the community, both from a health perspective as well as from an economic perspective in the community. And as the American Rescue Plan was released, the board asked that county administration take the time to study the bill, look at the Treasury Department guidance that would come out on that bill describing how those dollars can be used, and additional frequently asked questions and additional guidance from Treasury before making a recommendation on how to allocate these dollars. So over the past several weeks, we've held a series of stakeholder meetings and sessions to better understand the need in the community, understand the most pressing issues before making a recommendation to the board on a plan, which we provided to the board yesterday. So I'm going to walk through this briefly here. A few points, though, before I do so. This is a little bit of there's a difference between the CARES Act and the American Rescue Plan. With the CARES Act, we received those dollars just about a year ago, maybe a little bit over a year ago, and initially we were told we had until the end of 2020 to use and to allocate those funds. With this particular program, the American Rescue Plan, we have until the end of 2024 to use these dollars, and actually even longer, a little bit longer than that, to actually spend them. So we certainly know that there's an urgency in the community. We want to get these dollars out as quickly as possible, but we also want to make sure that we are being as transparent, as inclusive as possible, and that we're being as strategic as we possibly can in deciding how to use what really are once in a generation funding opportunity from the federal government. So a couple of points. Number one, this is a conceptual plan. It speaks mostly at a high level to areas of need, and you're going to see less in terms of specific programs or certainly organizations, et cetera. That's all going to come a little bit later as we have public hearings, as the board starts to put its fingerprints on this, and the board ultimately decides how they want to use these dollars. Then we will go out and determine how best to implement this and how to put the legs on the proverbial stool. Second, it's designed to be flexible. We are while we have received Treasury Department guidance, it's about 150 pages worth of guidance. That clarity from the Treasury Department is still going to be forthcoming. So as much as we were hoping to have every question answered through the Treasury guidance, we're not there yet. We're not likely to be there even over the course of the next several months. But as we go back and forth with Treasury, we'll ultimately get the answers that we want in terms of how to use these dollars. And finally, as it should go without saying, all of the recommendations that I'll be walking through here in a second are all subject to board modification as we go through the public hearing process. So, Bridget, I'm not sure if the slides are actually up yet. So it sounds like the first one is. So just a summary of the American Rescue Plan, $158 million. So as we did with the CARES Act, we're putting these into really 4 buckets. One is strengthening public health infrastructure. Number 2 is stabilizing the financial and operational situation of the county. Number 3 is addressing negative economic impacts in the community. And number 4 is addressing issues of community infrastructure. So I'm just going to walk through each of these here briefly. Again, this is a high-level conceptual plan. So the specific program recommendations are still open for deliberation, but I'll just walk through at a high level what we are looking at here. First is the under strengthening public health. We have $24 million allocated under that broad allocation. The first subline would be to address the emergent needs and long-term community resiliency. We have $6 million allocated towards this. So essentially, the first thing we want to do is make sure that we continue to put the fire out as it relates to the health impacts of COVID-19. So if there are any continued urgent and emergent needs out there, that we make sure that we get those addressed. And secondly, that we make sure that as we address those health needs, that we are working with our partners in public health and our partners in private healthcare institutions to make sure that we are better set up for the potential next time that this may occur. We think that as the community is getting $158 million, that the public has the right to expect that that money be put to use so that if in fact there is a next time, that the community is stronger and more resilient and better able to take that shock down the road. Secondly, behavioral health, mental health, and substance abuse services. We know that incidents of depression, anxiety, and mental health concerns have risen dramatically over the course of the pandemic. We think they were on the rise before that, but we know the pandemic has exacerbated that. So we have dollars allocated for those purposes. The American Rescue Plan is very big on the issue of ensuring that we use these dollars to address the disproportionate impacts to communities, particularly as it relates to health. So we did specifically put dollars in our recommendation around addressing those needs for disproportionately impacted communities in Hamilton County. Both in terms of the delivery of public benefit and health services. Commissioner Reese has talked about being mobile and getting out into the community and making sure that we are taking health and other social benefits out into the community and engaging the community. The American Rescue Plan is very consistent with that policy goal. So there will be a lot of that in our plan. There's some specifics here. We did allocate $5 million toward what is a high-level policy goal of the Board of County Commissioners. And we've been working on in partnership with our friends over at the city in terms of moving the police department, the Cincinnati Police Department gun range from its current location in Evendale to another location in the county where we can remove the negative impacts that it may have on surrounding communities like Lincoln Heights. Bridget, if you wouldn't mind flipping the slide there. Second category is stabilizing county finances and operations. This was a big part of why the American Rescue Plan was initially established, was to address, at least as it relates to the state and local government aspect, to address financial concerns to local government. So we do have $20 million recommended for revenue replacement. Our read of the rescue plan at this point in time is that the dollars that are provided to revenue replacement cannot be used to simply pad a fund balance, but in turn have to be cycled through in terms of the provision of government services. So we do have some specific recommendations for the board and the more detailed narrative on this as it relates to using those dollars primarily for construction of infrastructure, of needed public safety and other infrastructure in the county. We have dollars allocated towards capital improvements in our county facilities, mainly to make sure that they remain robust and strengthened against the spread of viruses, in particular COVID-19, in our buildings. We have an allocation of dollars for the creation of a satellite office. A high-level policy goal, again, of the board has been to better engage our citizenry with county services, especially those in vulnerable or disproportionately impacted communities. So we have some money in there for that. We have dollars to address public safety payroll, which is allowed by the rescue plan, to provide premium pay for workers who have been, again, disproportionately impacted in terms of having to conduct their job day in and day out through increased exposure to COVID-19 over the past year and a half. We have some money to implement the program for county staff, which is more of an administrative type function, and money for the Emergency Management Agency to continue to deliver the services that it has provided in terms of personal protective equipment, storing of vaccine, warehousing of this type of equipment, etc. Bridget? The largest aspect of our recommended plan is addressing negative economic impacts. The largest of these being what we've heard in all of our stakeholder sessions, what we've heard from the board, what we've heard from other community representatives, is the systemic need for housing, and specifically affordable housing in the community. So we have in our plan $40 million allocated towards the production, preservation of affordable housing, as well as homelessness protection programs to make sure we prevent people from transitioning into homelessness, as well as mortgage assistance for homeowners. We heard from the Board of County Commissioners in particular that we want to make sure that we, in addition to the rental assistance programs we've received, that we make sure that we provide protections for homeowners as well. We have around $15 million for workforce development, which would include specific targeted training, services for youth training, as well as childcare, which we know is serving as an impediment to people getting back into the workforce nationally, as well as here in Hamilton County. We have dollars allocated towards nonprofits. We know we have a lot of just a very robust nonprofit community in Hamilton County that provides a lot of critical social services. Many of those are still hurting. Some of the Treasury guidance may not be specifically aligned with directly benefiting all of those institutions, but we did put aside $5 million to make sure that we had an avenue towards addressing some of those concerns. We learned through our CARES Act funding that we have a lot of small businesses in this community that do exceedingly well at their craft, but may struggle with the provision of back office support, and that is a barrier towards getting them to the next stage in their business expansion. So we have some funding set aside for helping with back office support for, in particular, small minority businesses in the community. We have another round of small business assistance recommended through this plan, as well as some specific assistance to the hospitality industry and the arts and culture industry in Hamilton County as well. And Bridget, finally, the American Rescue Plan is very specific about funding issues related to broadband and other utility infrastructure. So we have money set aside for addressing issues related to broadband infrastructure, as well as affordability and access of high quality broadband services in the community, as well as some specific money put aside towards some strategic expansion of utility services in the county, as well as addressing some flooding issues in the county on a strategic basis as well. So with that, that's a quick run through on the plan. Just a plug for our virtual public hearings that are coming up Tuesday, May 25th in the evening. The exact time is still being deliberated on that, and then 1 o'clock at our Thursday, May 27th meeting of the board. So with that, Madam Vice President, I will turn it back over to you.
Thank you, Jeff. And as Jeff has indicated, our board will be looking at these recommendations. A lot of things that are in there that he highlighted came from feedback from all three of us. But certainly we want to hear from the public. I do want to indicate, because there's an area that I heard from a lot of people from the public dealing with tax reduction. And so we're looking at ways in which we'll be able to hopefully help homeowners and property owners reduce their taxes. So we are looking into that. That's something I know very important. I've been pushing for some time, and certainly other members as well. And also how to reduce the utility costs in terms of MSD, your sewer bill. So those are still on the table, and we'll be happy to hear the feedback from the public. Also wanted to let people know real quick, child tax credit from the American Rescue Plan. I think we've got a slide up real quick. $3,600 for children under the age of 6, or $300 per month, which is an increase from the $2,000, and then $3,000 for children 6 to 17, or $250 per month, which was previously credit for only 16 up to 16 years of age. So these things have changed, and those who are eligible, it should come to you automatically. If not, you can go to 513relief.org, and they've got all the information for questions. And then lastly, as I said, this is one of the, we got one more briefing after this, but it doesn't mean that COVID-19, we're not still fighting it. It's still out there. We still have to be cautious. And I just want to commend our county. And when I say our county, I'm not talking about just county government. I'm saying Hamilton County, the residents of Hamilton County, both the public, all three, public, private, and nonprofit sector, came together in collaboration, a collaboration that we've never seen before, but something that should be a model for our county going forward. We had communication, we had innovation to help people both save their life and their livelihood at the same time. We had cares and rescue. We're here to rescue the people, invest in people, stabilize people, reboot and recover. And so I'm excited that the Economic Relief and Recovery Task Force will continue on those issues. So just wanted to highlight and thank the entire Hamilton County. And also don't forget, Get Your Cincy On campaign that was launched last week. And we announced it last week. It was launched this week in a partnership with the Convention and Visitors Bureau. We certainly help businesses with small business grants to stay open, but they need customers to remain open. And so this campaign talks about the safe way we're reopening our county. So support our restaurants, our hotels, our entertainment facilities, our outdoor facilities, so that we can support jobs and keep these small businesses going. So with that, we'll open it up for questions.
Thanks, Commissioner. Up first, we have John London from WLWT News 5.
Thanks. Alicia, for you or Jeff, or maybe both of you, I know you touched on it a little bit, but it was exactly what I was thinking of, because there's a lot of numbers that have been thrown out here. But you mentioned that you've heard from some people about reducing taxes and reducing the sewer bills. And I was wondering what you were hearing. I know the public hearings are coming up, but what feedback are you getting from the public, either through emails or word of mouth or your own experiences, as to how they want this money spent?
Yes, and we'll hear a lot more when we have the public hearings come up. But let me just say, as I have been out, and I'll let Jeff answer on the other side, the technical side of the tax piece. One of the things that I heard when I was running, and I was running in the pandemic, was how do we hold on to our homes? We have far too many people that are at risk of losing their homes, and we from a national perspective, there was a lot of help for rental assistance, and we're still doing that. And I want to reiterate that even though you didn't see it in this plan, it's not in this plan because rental assistance is a separate funding piece that is coming in. So please don't think rental assistance is not a part of this plan. It just doesn't have to come out of this allocation. So we have about $20 million, I believe, of rental assistance just with us, not including the city's portion. So rental assistance, there's been a lot of focus on that. And what I heard was from people say, okay, that's great, but what about me? I'm trying to hold on to my home. We even read a letter when I first announced the Economic Recovery Task Force from a senior who hand wrote us a letter and said, hey, I never missed before, but it's tough on me after COVID, and please help me hold on to my house. and we were able through the administration and work to help her stay afloat for right now. But it opened our eyes that we need a home assistance for people who own their homes, who occupy their homes and own their property. And that was one of the things that we didn't have in the last one, that we certainly feel, I believe my colleagues as well, feel as though we need to have in this one. How to help people hold on to their homes and their property. Obviously, it's a buyer's market right now. We've got a lot of out-of-town investors that's coming in to Hamilton County, buying up people's homes. And certainly that will have an effect on our future in Hamilton County. So we want to make sure people can hold on to those. So one of the things we did ask Jeff, and he could talk about this, we asked him to look into every way possible that we can help people hold on to their homes. If it's helping them with their mortgage assistance, is it helping with, I'm open to looking at the property tax rollback promise that none of us was here, but we hear about. This might be an opportunity to do that, possibly, but we're looking at what are the rules and the regulations. So we have said property taxes, reducing those taxes to homeowners, providing assistance to homeowners, helping our seniors specifically stay in their homes. We want all of that aggressively on the table, and they're looking at the rules and regulations regarding that. But that's one of the things that I have been pushing since day one, because I've heard it from so many people. And I think it's so important as we are pushing for Hamilton County to be a place where it's affordable for people to live. And when I say affordable, I want to reiterate, sometimes we say affordable and we only look at what the federal government guidelines are, and sometimes that's really, really low. But it's a whole lot of people in the middle who don't qualify for a lot of programs, who have been paying and they need help. They need a break. Just because COVID, you got your vaccine, that's great. But people, 7 weeks out of work, or a year out of work, or even a month, it has affected people's bottom line. So, Jeff, you want to talk about that portion?
Thank you, Commissioner, and thanks, John. Yeah, just very briefly. So the plan that we've recommended does include some specific dollars for mortgage assistance in this particular case. We also know that there are the county's receipt of dollars is $350 billion out of what was a multi-trillion-dollar program, essentially, when you get right down to it, which includes other programs related to homeowner assistance, mortgage assistance, et cetera. So we put an allocation in our plan for mortgage assistance specifically, but recognizing that we need to integrate those dollars with some of the other programs that are going to be made available through the American Rescue Plan as well. To Commissioner Reese's point, she alluded to the regulations and how we can use them. There is a question with the Treasury Department that we are working through. When I say we, I am fairly certain that pretty much every local community is going to be asking the same question of Treasury, in that the law as written and as refined in the Department of Treasury's guidance specifically indicates that these dollars that the county has received cannot be used to directly or indirectly offset the reduction of tax revenue into the community. So I think that was the federal government's way of trying to ensure that local governments were not just using it to offset revenue, but making sure that these dollars get out to specific areas of need. But I think in setting that broad standard, there's also some individual community specifics that can be missed. So we need to go back and ask Treasury what that guidance really means and whether there is any flexibility there. So we'll certainly be doing that over the next couple of weeks.
And Jeff, just one other quick thing, if you would. You mentioned that you have till the end of 2024 to spend the money. What's the current thinking on that? Are we talking about parceling this out over that time, or not?
Yeah, I think it's going to depend a lot on how these programs come together. The recommendations we provided to the board, and we really thought hard about this as to whether or not to put out or put together a multi-year plan. But I think we're so high level at this point with it. We're so much at the beginning of the process that it really made more sense to provide the board with a recommendation of the total amount. I completely believe that many of these programs are going to be parsed out over the 4-year period. Some are going to be allocated and done immediately. I can say from experience that the small business assistance programs that we've done in the past are implemented, executed, and done within a couple of months. There's going to be other programs that are on a much longer burn rate. Affordable housing programs are going to take much more time to plan, make sure that we're hitting the niche in the community that we want to hit as effectively as we possibly can. So I think it's going to be a mixed bag, John.
Next up, we've got
John, did that answer all your questions?
Yes, no, that's fine. Yeah, thank you very much.
Okay, and I just want to add that we are looking at a balance of right now, which is relief, and investing in something a little more long-term, which is recovery.
Okay, thank you very much. Next up, we have Chris Wederick with the Business Courier, and he has questions possibly for Greg or Jeff.
Let's start with Jeff, just because it's related to the ARPA plan that he just outlined. Jeff, when we look at the amounts that you have going into kind of the county itself, the budget, is the budget deficit for 2022? Is there a number on that at this point?
No, in fact, we're not anticipating necessarily a deficit. We have identified long-term revenue loss under the formula that the Treasury Department has given us. But this, essentially will the programs that the revenue replacement will go to, Chris, are turn around and putting those into pay-go construction projects, et cetera, for public infrastructure, public safety needs, et cetera. So it's not necessarily going to be going to offset a budget deficit. While we are able to show a revenue loss and reduction with the Treasury as doing the calculations through the Treasury Department's guidance, at this point in time, our first quarter projections are not showing that we're going to end the year this year with a specific deficit. But looking back to 19 up until now, we can show specific revenue loss and revenue streams that allow us to use revenue replacement for some more flexible uses under the rescue plan.
So just to make sure I'm clear, basically you would replace some revenue with this money and then use what you replaced to fix a building or something like that, right?
Yeah, and so the Treasury guidance has some very specific criteria as to what they would accept. Now, it says not to be limited to, but we want to try to stay as close as possible to what the Treasury is indicating, and that includes pay-go construction projects for infrastructure, for buildings, particular public safety and health, that type of thing. So we have some recommendations that we'll be providing to the board on where some of those projects might be.
And so on the question of the PRT, that's something you're still trying to figure out. Was that the upshot of earlier's comments?
Or the property tax rollback, Chris?
Yeah.
Yeah, we don't specifically have a recommendation for that in this particular plan, primarily because at least our initial read of the guidance has some pretty strong language as it relates to using dollars to offset or even indirectly offset a reduction in tax revenue or a planned reduction in tax revenue. But certainly we know that the board policy guidance is and has always been to try to provide as much of a property tax rollback as we can sustainably provide. So we are continuing to seek some guidance from Treasury, and to the degree that opens up as a possibility, it's something that we'll review with the board.
Thanks. And then two other things real quick. Will the $5 million for the gun range, will that take care of that? Will that move it, or is there going to need to be a contribution from the city as well?
I don't think we know yet in terms of an entire cost. So we put $5 million in to allow us some ability to assist with that project. However, it is scoped out, but we don't have any kind of final cost estimate on it or anything like that. So it's largely a placeholder to make sure that we are using this time to ensure that we can assist with one of the board's top policy priorities. I would say on that one that it is something that we continue to have to ask Treasury about as well, to ensure that type of project can be utilized, but because of its impact on some of the surrounding communities and the Treasury Department's guidance, which specifically seems to be focused on alleviating disproportionately impacted communities, I think we should be good there, but we still have to clarify it with Treasury.
And then last question for you, the 40 million for housing, you've got a number there for production. Is that like a revolving loan fund, direct grants? What's the concept there?
Could be either, Chris. I think the program on that still has to be established. We at the county have done through our home funds, which come as a part of our entitlement grants to our community development office, have done a lot of grants on affordable housing, which have leveraged additional housing production in the community. We could follow that model. We could also establish some type of revolving loan fund as well. I think there's a lot of ways to set this up. And as with a lot of these types of programs, I think what we will do is once we get the board feedback and the board finally decides how they want to put this program together, we'll then get together with the specific stakeholders in the community, the best and brightest people in these industries, and figure out what makes most sense for how we go about putting a program together.
Is it proper to think of that as affordable housing mostly for that $40 million, or how would you describe the income levels that that's intended for?
Yeah, I think broadly we've described it as affordable housing, but I will say that the board has been adamant about wanting to structure a plan this year for the county's role in housing altogether. So, affordable housing obviously includes a spectrum of different things from and housing needs in the community. There's a spectrum from market rate, all the way through affordable workforce housing, transitional housing, supportive housing. I think at this point we're keeping it as flexible as possible because we know that housing came up in so many different stakeholder discussions we had. Everything from people just advocating directly for housing needs to folks on the mental health side of things saying we need more supportive housing, to folks in the senior services area indicating the need for housing, to folks in the homeless community looking for transitional and supportive housing. So I think we wanted to leave it as open as we could at this point. We'll define it as we get more into the public hearing process.
Thank you, Jeff. I appreciate it. I've got some a couple questions for Greg. I can go after somebody else if you want, Bridget. I don't know what the order is at this point.
Go right after, but I just wanted to add a couple of things. It's really important that Jeff mentioned. Now that the recommendation will be given to us as a board, we have the hearings. It will be up to the board on how we're going to. It's in our hands now. And one of the things I wanted to highlight that is being worked on now at the request of the board is a overall plan for housing in Hamilton County. I think it'll be the first that we've ever had. So we'll be able to see everything, all of our 49 municipalities, and the impact of housing. And with these dollars, we'll have some money set aside to say what type of product is necessary. So I just wanted to highlight that we do have that in the works, and it should be coming pretty soon, where we'll be able to see what we look like from a housing perspective countywide. And so from an ownership, rental, affordable, and what is affordable in the different levels. And these dollars will allow us then to have money available to have an impact based on this study that will be coming out and this whole countywide housing plan that will be unveiled to us. So that will help us where we're not just doing hit or miss. And I think that's one of the things that's been hard for us. If we do a project over here or a CRA over there, how does that impact housing in general for the entire county? So I wanted to highlight that. And then the second piece I wanted to go back to on the property taxes. There are a couple proposals. One is the property tax rollback. The other is if there's funding that can help people become current with their taxes that got hurt with COVID. And then there's one looking at utilities. Can we help with the sewer bills? And so we've asked for something in writing. The administration is going to get from the Treasury in writing before we make our final decision on the recovery plan. And if these things are allowable, then we are looking at possibly making some adjustments to make sure that that is part of it, because we know we've heard feedback from a lot of people on those issues as well. So I wanted to highlight that that's not off the table, but something that we're asking to get something in writing back, and the administration is working really hard to get an opinion from the Treasury Department. So thank you. Okay. Commissioner Kesterman?
Hi, Chris.
Hey, Greg, just a couple questions. At this point, what are the prospects of reaching 80% vaccinations by July 4th, the goal that the community, I guess, set a few months ago?
At our current rate, I don't think we can meet the July 4th deadline. However, we are seeing more and more people each week get vaccinated. And so over time, I think we are actually going to reach 80%, but it might take a few more months beyond July 4th.
Okay. And does it matter given the low number of cases at this point?
It's interesting if you look at last summer, just because folks play outside and recreate outside more, our cases dropped as well. This is our first time through this pandemic, so we don't have all the answers as to why and what is driving our case count down. But we did still see last summer a fairly high number of folks in the hospital. So even though our cases came down, our hospital systems were under more stress than they are today. And I've kind of said throughout the pandemic, one of the key indicators is really truly our hospital systems and what stress they're under. If we can't get care, if somebody has a broken leg or a heart attack and they can't get appropriate care because the hospitals are stressed, we as a community are in trouble. And so we'll continue to watch that number very closely, along with deaths and all of the metrics. But at this point, things are definitely heading in the right direction.
With everybody who's had it, when you add it up, I mean, I feel like, and I know there's probably overlap, maybe even major, but I mean, it looks to me like maybe we're approaching 60% who've either been vaccinated or have had it. Could we reach herd immunity anytime soon?
Once again, this is a great question. We are really watching information from the Centers for Disease Control and learning about the pandemic as we go. We know that if you get COVID-19, you do have some level of protection. The CDC has updated their guidance and says you have at least 3 months of protection, but they still recommend the vaccine because we know the vaccine is absolutely effective against the variants. We don't know if your COVID illness is effective against the variants. We have a lot to learn. It may be, it may not be. So what we are encouraging folks to do is to continue to go learn about the vaccine if you've not done so and get vaccinated. And hopefully what you're suggesting, the 60% either have had it or have been vaccinated, is accurate, and we continue to see herd immunity build up within our community.
Thanks, Greg. Appreciate it.
Thanks. John London from News 5 has a follow-up question for Commissioner Reese.
Yeah, Alicia, I wanted to hear from you, talk a little bit more about the child tax credit, because there are young mothers, as you no doubt know, who benefit from the child tax credit. And I wonder if do we know the number of families who are going to be assisted in Hamilton County by the tax credit?
Thanks. Thank you, John. I'm pulling out my notes here. In terms of the actual number of families that will be affected in Hamilton County, we don't have that exact number. But I can tell you that it will have dramatic effect because when you look at the change, a couple things that's good about it. One is you don't have to apply, so they will find you. And if you have issues, obviously you could go to our 513relief.org. But when you look at the number, it was $2,000 and now it's $3,600. I mean, that's a big difference in a family. And then when you look at children 6 to 17, it was cut off at 16. So when you look at now, I was at a high school graduation, and there's more coming up. My high school is having graduation next week. Withrow, and I look at the students, they're 17 and they're, just now graduating from high school. So they're still in the care of their family. And so you look at $3,000 will be available, and they added on an additional year. So I think that people will definitely see an effect. A lot of families will see effect as it relates to this child tax credit. But the main thing, we wanted people to know that it's available, that it's coming up, that it's here. And so that's we're working through Jobs and Family Services to make sure that people are aware of that.
And it's available now?
It's available now. Available now. And so we wanted to make sure people knew about that. And one of the things with our economic relief and recovery task force, one of the major goals is educating people on what is available, because so many people never had to access government assistance. And then you hear about all these things and you're like, what is going on? Or you hear about it when it's too late. So we really have focused on communicating as best we can to make sure people know that this is available. But this is a huge deal. It's a huge deal for so many families right now.
Okay.
Thank you very much.
Thank you.
And that seems to conclude our questions from reporters.
Thank you all.